Hi
there.
Hello, Devon. Come in.
Hi.
Take a seat. So it says sick note on my list. Is that right?
Yeah. Basically, well, you won't have known everything because I've only just moved over. But basically, I was doing a course. I was doing my PGCE.
All right.
And then I went into hospital for shortness of breath.
Yeah.
I assumed it was just my asthma because I have asthma. Went in. They couldn't find anything on my chest, so it doesn't sound like an asthma because your chest is clear. Then they took some bloods, and then they said they found a very, very small spike in something. They even said if you've been 10 years older, they'll let you go home. Because of your age, we'll have a look. Couldn't find anything. Blood came, did another blood test. That spike had gone. But they wanted to keep me and find out what it was. Couldn't find anything on my blood, said I was fine. Then they did an echo.
I can see the result.
Yeah.
Yeah.
So then that happened.
Right.
But because my body shows no symptoms, they're really not sure what caused it, and they're like taking things really, really steady, essentially.
Yeah.
So basically, what's happened is that I asked them, well, I've had to come off my course now, which means my bursary stopped. Will I be able to? Should I be looking for work? I mean, what? Because I'm having, and they just went, no, absolutely not.
No.
So I've had to start applying for some of the benefits.
Sure.
And then they're saying, well, we need proof.
Yeah.
So they were
problem.
like,
that's no problem.
The thing is, I think I need two, because I need to send them to two. I need to send one to my student loans people, so they know why I've come off my course. And then I need to send one to the Department of Work and Pensions. So
all you need to do is just take a copy of one.
Yeah, okay, that's fine. That's fine.
Because technically, the note belongs to you, and, and so you could ask people to take a copy and give it back to you. But
that's fine.
Just give the original to the Department of Work and Pensions.
And then send a copy to my student loan.
I think pragmatically, that's probably the best thing to do.
Yeah, I'll do that.
So on there, do you mind if I put severe heart impairment, severe LV impairment?
Yeah.
Is that all right?
That's fine. The other thing.
Just before we move, when do I need to start it from, Devon?
Today.
Right. Okay.
Today, because they gave me a self-referred one which runs out today.
Yes.
So
sure.
if I start it from today.
And then do you think we could just speak on the phone in a month?
Yeah.
Also, just to review things.
Yeah. There's one other thing that as a result of this, I've started to notice that I'm starting to suffer quite badly with anxiety, and it feels like it's slowly getting worse. My wife has mentioned that there's a few groups, like there's like a Black Health group, which she reckons I might be seen quicker, because obviously you get put on the waiting list, don't you? And she says I might be seen quicker. I was just wondering, what's your opinion on, like, do you think I'm better to be put on the waiting list and wait for you guys, or do you think I should try and get, because it's getting to the stage now where I only feel comfortable when I'm sat in my car.
Right.
I don't really want to walk anywhere, because I'm the sort of person that always used to just power through things. Right. So if I felt a bit tired or felt a bit breathless, I'd be like, I'll be fine, just keep going. Yeah. But then, like, the doctors have been like, take note, find out what it is. Yeah. And then you go from not noticing anything to noticing everything.
And worrying.
It's like every time I go upstairs now, I notice, I do get out of breath. And when I wake up, it's like, I do find a bit of tightness of breath. And then when I'm at home by myself, and it's like, you've got to go somewhere, I'm like, well, what if I collapse? What if I get short of breath again? What if I'm on my own? Whereas if I'm on my car, I know I can just stop, and I can call someone from my car and I'll be fine. So that's where I feel safe. But it's like, It's getting, but I don't even like talking on the phone. I'm normally quite outgoing, so my anxiety now is becoming a bit of a problem, which I think might be having a knock-on effect with my chest, because obviously it raises your stress levels.
Yeah.
So I'm at the point of going, I just need to get this fixed. I don't want to wait till I'm a cabbage, and and a basket case, and I don't want to do anything.
What about your mood, apart from the anxiety?
I find myself. I try and keep myself busy. I try and keep doing things, but I do notice that I'm getting more lethargic, which my mum suffers with depression, and I'm starting to see some of the signs that she struggles with in myself. So a lack of motivation to do anything.
Right.
I generally seem to feel that part of the reason I'm anxious of making phone calls is because I always imagine that the news is going to be negative, straight away.
Right.
I don't want to, like, even sat in the doctor's surgery, in the waiting room, nobody knows what's going on, but I'm assuming everybody's looking at me going, oh, it's because he's overweight, which is why his heart's problems. How would they even know? But that's the thought I have before I get out. And I know it's not because of weight, because I spoke to the doctors and they said your bloods don't show it's weight, because your cholesterol's actually really good and everything else is really good. But I do feel like I don't feel comfortable. I feel a negative impact for doing everything.
Now,
but I just push through it at the minute.
Sometimes when people feel down and they've got these consequences, sometimes we can feel hopeless and that life's not worth it.
I'm not feeling suicide. It's more of a case of I don't feel worthy of living. Like, I look at my family and I look at them and I'm going, look at everything I'm putting them through.
Right.
But I'm not of the case of I don't deserve to be here. It's more of a case of sometimes I feel like running away.
Right.
But not wanting to run away because I knew I'd miss them too much. But I kind of look at them and go, they don't deserve to be going through, because obviously with me now not working, they now don't have that income that I was bringing in. So like there's been a bit of a life change, and I feel like it's on me, and I don't know. I had a conversation, and like the nurse that I see every fortnight, she was saying, you went into hospital in the midst of a very serious attack, and when we did all our observations, we got a minor spike of something that if you were ordered would let you go home in. There is no way you could have predicted that this was coming.
No.
And she said that, and I felt good for a time, but then I was thinking, well then why was it high? Because I used to get blood tests done every year, because I knew there wasn't something right, because I used to keep getting swelling to my leg, and I get scans and everything, and they couldn't find anything. And so I was actively looking for it. And then there's lots of other like things as well, like my mum's ill, but my mum's a heavy smoker and a heavy drinker, and you know, she cooks with too much salt and things like that. And I don't get me wrong, I'm a big guy, but all these problems seem to come when I started to lose weight, which again the nurse says there's a possibility that that's linked to my heart as well. And I'm like, oh my gosh, because I find it really difficult to lose weight, and I used to find if I lost like a stone or more, then I would get swelling or I'd get pain or anything like that. And then she used to say it could be your body starting to just store everything because it thinks you're not well. And I'm like, oh.
Well, you're certainly describing some features of depression there.
I do feel,
as well as anxiety.
I'm trying to, this is the reason why I'm trying to get help now, because I saw where my mum went.
But apart from talking, though, have you thought about anything else?
No, I kind of want to start out with the talking.
Okay.
That's not to say I'm ruling out anything else.
Yeah, sure.
But I kind of want to start on, in terms of that, because my mum went straight for the meds.
Sure.
And now that's how she functions. I kind of want to go in at the low level
Well, look what I printed out for you. So your sick note's there,
Thank you.
but there's the local talking therapy service with the self-referral number. You don't need me to refer you for that. You can just refer and just tell them what the problem is, and tell them your medical problem as well, that you've got this severe heart failure, and then see what they can offer you, and they might well prioritise you because of that.
Okay,
All
that
right?
would be great.
And also on the back there are some other resources on the second page, particularly if you ever did get so hopeless that you thought you were just going to do yourself in or harm yourself or something like that. That's the emergency crisis number for...
No.
I know.
No,
but just in case.
I'm just saying at the minute, I'm glad you told me, but at the minute I just feel like running away.
Yeah.
It's
really common.
Yeah.
When in a situation like yours, I think anybody would feel the same.
Yeah.
Yeah, not just you. I think it's entirely normal for you to feel stressed by this situation. It's a big deal.
Yeah.
It's a big deal. So
Especially when I just thought it was an asthma. It's like I thought I'd just get a stronger inhaler.
This condition is a nightmare to diagnose in young people.
Yeah.
I've been talking recently at a seminar about it. It's really difficult. It's really difficult. So at least, good news is at least you've been identified, and then you can be put through the treatment and follow-up. And so thank goodness at least they know.
Yes, and that's the benefit.
So the sick note's done. There's a referral. Why don't we speak?
How long is this? Is it for a month?
A month. Okay. Why don't we speak in a couple of weeks and just review how your mood is doing, and if it's dipping, then so if you just come back and I think I'm not here in a couple of weeks because I'm away. If you just maybe see one of my colleagues. Yeah. And then just have a chat. I think that would be a good idea.
I think that would be beneficial for me as well. Yeah. Thank you.
Is that okay? Good.
Yeah.
My pleasure.
Thank you.
Hang in there, okay?
I will.
Other people do get a lot better.
So
just hang in there.
I will.
It's not hopeless. Okay?
I know.
I've seen other people like you, young, this condition, and they've gotten better. So think positive.
All right. All right. Thank you. Thank you again.
All right. Take care, Devon.
Thank you. You too. Bye.
Bye.